Bonsoir à tous. Bienvenue à cette conférence de presse du Premier ministre du Québec, M. François Legault, du ministre de la Santé et des Services sociaux, M. Christian Dubé, et du directeur national de santé publique, Dr. Horacio Arruda. Le Premier ministre débutera par une allocution. On procédera ensuite à une période de questions. Je cède maintenant la parole à M. François Legault.
Bonjour tout le monde. Bon, d'abord, on voit qu'hier, on a encore eu 10 décès. C'est à peu près la moyenne qu'on a depuis quelques semaines. 10 décès par jour, 10 nouveaux décès par jour. Je ne sais pas s'il y en a qui s'habituent, mais moi, je ne m'habitue pas. Parce que derrière ces décès, il y a nos pères, nos mères, nos frères, nos sœurs, nos amis. Et il ne faut pas s'habituer. Et il faut toujours garder ça en tête quand on fait des efforts pour respecter les consignes qui sont données. Je vais commencer peut-être par la bonne partie. On arrive à la fin du mois d'octobre et on voit que les efforts qu'on a faits depuis le début octobre ont donné des résultats. On a réussi à atteindre un plateau. Un plateau, là, on le voit, dépendamment du nombre de tests, on varie entre 800 et 1000 nouveaux cas par jour. Par contre, ça amène à peu près 10 nouveaux décès par jour. C'est déjà une grande victoire d'être arrivé à maintenir depuis 3 semaines le nombre de nouveaux cas à 1000. Si vous regardez ce qui est arrivé au cours des derniers jours en France, hier, il y a eu 52 000 nouveaux cas. Si on fait une règle de 3, c'est comme si le Québec avait eu 6 700 nouveaux cas. Pas 800 à 1000, 6 700 si on compare des pommes avec des pommes. Donc, ça veut dire qu'on en a 6 fois moins de nouveaux cas que ce qui se passe actuellement dans un pays qu'on connaît bien au Québec, qui est la France. Donc, je veux, en commençant, vous dire à tous les Québécois, un gros merci. C'est grâce aux efforts des Québécois que nous, contrairement à d'autres endroits, on a au moins réussi à stabiliser. L'autre bonne nouvelle, c'est la situation dans les CHSLD. Quand on regarde le nombre de personnes infectées aujourd'hui, puis qu'on se compare avec la situation du printemps, on a 85% moins de personnes, de résidents, résidentes infectés dans nos CHSLD, 85% de moins. Donc, les efforts qu'on a faits au cours des derniers mois pour ajouter du personnel, pour ajouter une personne responsable dans chaque CHSLD, ça nous permet aujourd'hui de se dire la situation est sous contrôle dans les CHSLD. Par contre, avec 1000 cas, 1000 nouveaux cas par jour, ben, il y a un problème dans l'ensemble de la société. C'est trop, 800 à 1000 cas nouveaux dans l'ensemble de la société. Donc, il faut baisser ce nombre de nouveaux cas. Et c'est pour ça qu'on va devoir faire des efforts pour un autre 4 semaines. Donc, je vous annonce So I'm announcing to you today that the measures that we have set up in red zones and that we set up at the beginning of October are going to be extended for a further 4 weeks, so until the 23rd of November. However, I'd like to add right away that all the measures, the help measures for companies that have been forced to close down like restaurants, we are going to extend that help as well until the 23rd of November. Donc, on a encore,
so we still have,
Despite the fact that we've managed to stabilize numbers, we still have quite a challenge ahead of us. We cannot continue having 800 to 1,000 new cases per day. First, it brings about 10 new deaths per day, and I think that there is nobody who is wishing for that in Quebec. And it also brings about consequences on the health network, consequences on certain businesses and companies like restaurants. And it also has consequences on certain classrooms in certain schools. And moreover, we know that over the next few weeks, the winter is coming, so people are going to be inside more, so more at risk of contagion of the virus. And there's the flu coming as well, on top of all that. I'll admit to you that we asked ourselves the question, should we extend for 2 weeks or for 4 weeks? And I think that it is more probable that it will be 4 weeks. However, in 2 weeks, we'll reevaluate the situation. If indicators show a sustained drop, and when we say indicators, the number of cases, the number of outbreaks, the number of hospitalizations, if we see a sustained drop, we will be able to let go some of our guidelines a little bit earlier on. But for the time being, what I would say is we must just go to work and go to school, and that's it. Those are the two activities that we have to keep. And even those two activities, we have to be more prudent. Right now, there are too many outbreaks in businesses. So we have asked the committee, the CNESST, to go and have an inspection blitz. And we'll give fines where necessary, and even if the businesses don't change their ways, we'll have to close some down, because right now there are too many outbreaks. Public Health was saying so last week. Almost half of outbreaks are in businesses. So we truly have to act on that end. And I spoke with Jean Boudet over the weekend, and we have already started a blitz. We are going to continue that blitz in the coming days. As far as schools are concerned, today we have 891 classrooms that are closed. So once again, this is it's a number that is pretty much between 800 and 1,000, and what that means concretely is that 97% of children are going to school right now. And I told you, despite the choices that were made by other states, for me, the last thing that I want to close down are schools. So that we wish to maintain activities in schools as long as possible. However, public health, the experts are telling us, first, when we look at the number of new cases, there are more new cases in high school students who are a little bit older. And on top of that, we've been seeing, according to science, that children who are a little older transmit the virus more than younger children do. So we had already said that secondary 4 and secondary 5 students, grade 10 and 11, will go to school 1 day out of 2, but as of Monday, we're going to add secondary 3, so that is grade 9 students. So that means grade 9, 10, 11, or secondary 3, 4, 5 are going to go to school 1 day, and the other day they're going to do remote learning, so it's a hybrid system. Now, I'd like to come back to the death toll. The situation is serious. For me, we all have to realize that we can't continue having 10 new deaths every day. We have to make efforts. And tell yourselves, if the efforts that you personally make manage to reduce that death toll by 1, because one is one too many, so it will have been worth it. Your efforts will have been worth it to reduce the number of deaths. I also wish to say a word to employers. Each employer has a responsibility. First, as I was saying last week, we ask employers as much as possible to have their employees work from home. So remote work. But if they have no choice and the workers have to go on the premises, well, it is important that the guidelines be respected. So the mask, the 2-meter distance, employers have a responsibility if they see that the guidelines are not being respected. And as we were saying earlier on, half of the outbreaks are in businesses. So there is an effort to be made on that side. And just to end with one word on mental health, because I hear a lot of people say, well, we have to start with activities again. Listen, it is something that is so difficult to choose. You know, we have to choose a lesser of two evils, and it's wrenching to have to make that decision. Do we want 10 deaths per day? Do we want to create problems of mental health in Quebecers? Well, we want neither, but we are stuck having to choose to say, can we make efforts for the month of November, keeping in mind that we would really like to have Christmas with our family members or our friends. And once again, I need Quebecers. I need you. First and foremost, we've said it, and I'd like to repeat it. We have people who are alone. We have the right to go visit one another. People who are alone that you know, go see them. And if you see that there are people who have mental health problems, try to convince them to call Info Social 811 to eventually be able to see somebody. It's important that that people don't stay alone at home with these problems. So it is now time for the Quebec people to really get together more than ever. Our destiny is linked. We are linked to one another more than ever in the history of Quebec, and we have to pull together. And I trust the Quebec people. Thank you.
Good evening, everyone. Our efforts over the past month have paid off. We've stabilized the number of new cases. It shows that we're able to stop the virus when we all do our part. The situation is also under control in our senior homes. But we need to reduce the number of cases, hospitalization, and deaths. And to do that, we need 4 more weeks. I'm announcing that restrictions in red zones will continue until November 23. All the measures also to help businesses forced to close will also continue until then. We'll reassess the situation in 2 weeks. If our numbers decrease, we could see we can ease some restrictions earlier, but it will be only if the numbers decrease for a couple of weeks. For now, we only need to keep 2 activities, work and school. We need to reduce the number of outbreaks in workplaces. We're doing an inspection blitz to enforce the rules. Businesses that don't follow the rules could face sanctions and even closure. The situation is good in schools, but there are more cases among older students at secondary school. That's why I'm announcing that secondary 3 students will alternate between online and in-person school, like secondary 4 and 5, and will be starting next Monday. We've been able to stabilize the situation, but we still have 10 deaths a day. And every death we have is one too many. To fight this, everyone must continue their efforts to stop the virus. Everyone has a role to play. We're linked together as never before in our history. I'm confident we'll get through this together. Thank you.
On va débuter la période de questions. Je vous demanderai
We will start with a question period. Please limit yourself to one question and one follow-up.
On va débuter avec le micro 1. Je pense que c'est Radio X.
Bonjour, François Legault.
Hello.
Très heureux de vous retrouver aujourd'hui.
We learned today a little bit earlier on that 200 gym owners are going to reopen Thursday despite the imposed public health restrictions. So what can we expect Thursday? Will they have fines, those owners? Or is it the clients that are going to be fined? Well, the law has to be respected, so we will make sure with police officers that the laws are respected. The gyms cannot be open. There will be fines, yes. They will be distributed to the owners and clients as well. Also, the union members in schools are worried about the after Christmas period. Isn't it, couldn't we think about coming back to school later and to also shorten, to think about going back to school later in January or leaving for Christmas earlier than December to create a 2-month confinement? Is that in your mind, that idea? Not at all? No. Listen, we have already lost many weeks in the springtime that the students didn't go to school for a certain amount of time, so there is catching up to be done. And a part of that catching up was done as of September, so that means for the ongoing year, there's still catching up to do. So there is no question of shortening sessions. For working environments, do you know which sectors are the most problematic, and will the fines will be to employers and employees? And could you tell me, did you say that you might close down certain businesses? Well, if a company does get a fine and a notice with things that have to be modified and those things are not modified, well, the business might, in fact, yes, be closed down. As far as the ones that are at the highest risk, of course, we have seen a lot of slaughterhouses, businesses or companies, plants where perhaps the meat or the food. Listen, I'm not a specialist. I'm getting into something here, but I don't know if one of you two could help me out. Well, in fact, what has to be understood is that very often those businesses call out for employees from agencies that might come from different regions. And if the guidelines are not followed, it wouldn't be possible. It's not the first time that we would have seen all over Canada, I would say, places such as slaughterhouses where, because of the proximity of the work of the people, you know, they don't always respect wearing the mask, so there might be a more intense transmission, yes. Mr. Arruda, could you go back to the Halloween decision so that it doesn't do like, you know, with hunting lodges where we end up with outbreaks that could be avoided? Are there perhaps sectors that are too red that might not have to go from door to door? Or I think that with the protocol that was set up, first of all, it has to be understood that parents can also decide on their own to go for Halloween or not. The problem with Halloween is people gathering, particularly inside, you know. But we believe that right now, even in a red zone, if people respect the guidelines, you know, if the parents take care of their children, avoid gatherings, and that people who give and receive the candies accept certain of the guidelines, I think that there is no threat or significant threat to public health to prevent that activity, which is very important for families. You talked, and it's interesting, Mr. Legault, you talked about mental health of Quebecers. We're, you know, kind of stuck between in a very difficult place. Isn't there a danger for the mental health of Quebecers and a possibility of reevaluate in 2 weeks if everything goes well? I mean, isn't there a risk for the mental health of Quebecers to give them hope and perhaps have to come back? I mean, I know we're stuck between a rock and a hard place. Well, yes, it's a balance that is fragile. We have to give people the truth, but we also have to give a little bit of hope, particularly for the holidays, the Christmas holidays. But for the time being, I think that the probabilities are that it will take 4 weeks. But if we can do something different after 2 or 3 weeks, we will do it. But for the time being, there's way too many cases. 800 to 1,000 cases per day is much too high. And what does that mean, a sustained drop and a reevaluation in 2 weeks? I imagine that you have a specific number that you'd like to reach on paper in order to be able to change those measures that are pretty restrictive and that are being extended for 4 weeks. What would it need for us to come back to 2 weeks? You must have a number, maybe Mr. Arruda would complete. Well, first, we need a sustained drop over the 2-week period on 3 main indicators. So the number of cases, the number of hospitalizations, and the number of outbreaks. So what percentage of drop? Well, that will depend on many factors, and it will also depend on where the region is at right now. There are some regions where there's more work to be done. In Quebec, in Chaudière-Appalaches, there's more work to be done than in Montreal. The Premier answered very well. There's no clear number? There's not a specific number, because first, we have to have a decrease in the number of hospitalizations that will keep our health sector able to treat other emergencies that will come up. And it can vary from one territory to another. Not every territory has the same capacity. And then we also have to be able to decrease the number of cases in a significant way, because those generate hospitalizations and deaths. And we have to be able to have the ability to investigate all the contacts and traces. So we have to be able to follow that. And we have to respect the guidelines ahead of time. Communities have to collaborate. Working environments have to collaborate. So different communities to decrease outbreaks so that we can control the number of outbreaks, so that the numbers associated to each of the outbreaks be small. That is to say that we have 2, 3 cases, 4 cases that we're able to control. So it's all of that that has to be looked at. And it's all of that that we'll be looking at in terms of the national directorate, but with the public health directors who know their territories better, that will be able to say, well, here is an outbreak, here or not. So you gave yourself that 28 challenge to be able to lower the number of spreads in the reopening sector. Now we can see that it wasn't the case. Was the 28-day challenge too ambitious on your part, or do you think that the public didn't make enough efforts? Well, you can look at the glass half full or half empty. When I compare myself to France, that has 6 times more new cases than we do, I think that we have succeeded this 28-day quite well, and we've succeeded in stabilizing things. However, we didn't manage to lower, so we haven't really reached the entire objective that we had given ourselves. However, when I see the world situation, I think that perhaps, yes, nobody saw that the second wave was going to be so strong. You ended your statement by saying that you trust Quebecers so that they really get together and pull together over the next few weeks. There are a few groups, a few categories that refuse to do so. We saw the gyms today that have announced that they will be open on Thursday. There was a party in Airbnb in the Outaouais region. Over 80 students that got $1,000 fines. What do you want to do about those people? Is there going to be a tightening of measures? Well, it's difficult to control everything that is going on in more private places. I call out to people, and I trust Quebecers, all Quebecers that can understand the impact and the situation and the importance of following the guidelines. Well, they have perhaps a duty to explain it to the others, to their friends or people that they know who don't realize the impact. About businesses to follow up, do we have an idea? We know that there's a lot of outbreaks, but in what kind of businesses? What's wrong? Why are there those outbreaks? Do we have a global portrait? What we are looking at right now is very often it's a slackening of measures, because it's been many weeks that people have been back at work, and we can see that it's kind of like this loosening. It's like in hospital centers or in CHSLDs. It's the same thing at work. It's when people go for lunch. They end up together, they remove their mask. It really is a loosening, almost involuntarily, I would say. It's almost like, you know, when you get together among friends or you get together among colleagues. And that is why it's unfortunate, but we have to repeat the measures. So I think that what the Premier said earlier on, to go through the CNESSD in order to really remind people of the rules and guidelines, I think we'll see a difference there, because we need to continue reducing the number of cases. And if I were to add something, it's the entire question of hospitalizations as well, and I would like for us to just take a few seconds to remind ourselves. It's been many times that we've been saying that our healthcare system is fragile, and if people had to give themselves one reason outside of education, outside of getting ready for the holidays, we have a healthcare system that is so fragile right now that when we have about 550 hospitalizations like this, and we managed to control between 800 and 1,000. Imagine if we had been at 2,000 or at 3,000 cases. We don't have the means for our healthcare network, for the hospitalization. So I want people to remember that. And my second point is that as long as we stay at 500 or 600 hospitalizations, ongoing hospitalizations, that means that we cannot go and reestablish all the surgeries that people are waiting for. Remember that we have a lot of them where we're having a hard time going back to our regular activities. There's about 40,000 surgeries per month. When we get to 40,000 surgeries if we stay at 40,000 per month, we are not going to lower our waiting list. So not only are we putting pressure on our health network because we have more cases, but on top of that, we can't lower the waiting list for surgeries. So think of all those people, like the Premier was saying earlier on, all those people that you could help who are waiting for a knee operation or knee diagnosis. You have to think about all of those people when we talk about the fragility of the health network. It's not just hospitalizations, but it is putting the healthcare staff on the right things, that is, to care for people generally, not just COVID. How many surgeries per month should we make to catch up? Well, we have about 450,000 surgeries per year when everything goes well, so about 35 to 40,000 per month. If we want to reestablish what the delay that we've had of 140,000, we have to do 5,000 to 10,000 more per month to be able to lower that. So it's not a hospitalization problem that we want. We don't want COVID hospitalizations. That is what has to be understood. We have to be able to fix the problem of the first wave that's been dragging on for many months. So I think that if I were to make a link between what they can do to help us, it's really to make sure that we are going to lower the hospitalization rates so that people can start caring for those who are waiting for surgeries or who are waiting for a diagnosis. Thank you. I would like a clarification. You talked about 891 classrooms that are closed down. Is that cumulative, or it is as of now Monday? It's to this day. That is to say that it's cumulative. It includes all the classrooms from schools that are closed and all the classrooms of schools where there's only a few classes that are closed. So 891, we went up to above 1,000. That means that we have had a slight lowering. It doesn't mean that tomorrow we won't go back up between 900 and 1,000, but there too things have stabilized. So 891 is not the accumulation. It is up to today, Monday. Yes, that means that some classrooms have been reopened. Yes, we went up to 1,000. Some classrooms opened and some added. So today, as of today, there are 891, or Friday, 891 classrooms that are closed. Do we have the proportion between primary school and secondary? I don't have the number. Well, perhaps to go in total number of classrooms, it's about 45,000 classrooms that we have in total. So we go back to the same 3% that the Premier was talking about in terms of students or classes. It would be 800 or 900 classes out of 45,000. So that's a good proportion that we've managed to stabilize. During an interview on Friday, you talked about the number of 500 cases for the reopening of bars and restaurants and gyms. Is it still that number that you are targeting, or are you going back on what you said? No, listen, we are at 800,000, or rather, between 800 and 1,000. If we go down to 500 for 2 weeks, and we reduce the number of outbreaks, and we reduce the number of hospitalizations, then we'll be able to talk about loosening some of the guidelines. So that number is still there in your mind? Well, it depends. See, if there's more reductions in the number of outbreaks and more in terms of hospitalizations, perhaps we might accept a few more, or the opposite. So we have to look at the 3 indicators. As far as secondary 3 schools that are going to be going to school 1 day out of 2, why having chosen to stop that in grade 9? Why not go to also grade 7 and 8, secondary 1 and 2? And might that eventually be the case? Well, it's going to be science. I asked the same question as you said, and when I've been told that when you look at the number of cases and the transmission capacity, those that transmit more, those that transmit more or less, well, there is a difference between secondary 2 and 3. So that's a recommendation from public health that we're listening to. Mr. Arruda? Well, as I was saying, this is the recommendation that we are making right now. There are outbreaks in schools, but not uncontrolled right now. Adding this, the grade secondary 3, will help us reduce the number of outbreaks, but we're going to keep a very close eye on it. If ever there were developments, if the number of cases increase, if there are a lot of cases transmitted with younger people, well, we will reevaluate the situation. And we might also think, because we were all young at some point, that at that age, we perhaps respect guidelines a little bit less. Maybe. I'm just, mentioning the possibility. So there might be a question of behavior as well. We will now switch to English questions.
Good afternoon, good evening. Why 28 days? Why not more? Why not less? What made you come up with the 28-day number?
But it's after discussing with public health, it looks like we think it's reasonable over 28 days to see a reduction. During the first 28 days, we were able to stabilize. We think that it will take another 28 days to see a reduction.
And is there any more assistance coming to businesses that have been struggling with the measures? I'm sure a lot of people are hearing this and they're probably quite upset.
I have to repeat that there's no province having given more help to businesses than Quebec, by far, and will continue to do so. I understood, and I've asked questions today about the delay to get the help. Some of them told me that it was a long delay, so I've asked Pierre Fitzgibbon to make sure that we shorter the delay.
We'll switch to Gloria Enriquez from Global News.
Good afternoon. I'll just ask you to repeat what you said to my colleague in French about why not expand it to all of high school students. Just go with Sec 3. Why not all students?
Okay. When you look at the figures, there are more cases with students of secondary 3 than for younger students. Also, the transmission rate is higher for them. So it's a recommendation given by the public health, and we accepted it.
And why not expand it? To prevent?
But because we think that it's better for the students to be at school 100% of the time. So it's the balance. We think that with this measure, it should be enough to decrease the number of cases, of new cases every day.
And in terms of the businesses, you said half of outbreaks are coming out of there. Do we know what kind of businesses specifically? Is it retail? Is it offices? What kind of businesses are?
It's not retail. I think that because we thought about doing like we did last spring to say, should we see what do we do with the retail businesses that are not essentials? But it looks like that's not where's the problem. It's more in the manufacturing business, especially in the food business, that we see more cases.
And finally, gym owners, you must have heard they're saying that regardless of the rules that have been imposed, they will open because of the mental health of their clients. So what are your thoughts on that?
I understand that the mental health is at risk, but right now we have to choose the less worst solution. And I understand that there's an impact on mental health, but the gyms will have to respect the law, and police people will assure that, and they'll have fines if they don't respect the law.
Perfect. Thank you.
We'll go with Matt Damour from CBC News.
Good afternoon. The first question is for you, Monsieur Legault. 28 days ago, we heard from businesses, especially places like bars and restaurants, who said this was going to be absolutely devastating for them. We're now possibly doubling the length of time that they're going to have to either be closed or seriously restricted in what they can do. You've talked about the help that Quebec is providing. If you can shortly just remind us, what does that help look like right now? And looking at another month of this, are you looking at other possibilities? Because we're talking about, you know, maybe a sixth of the year where some of these businesses are going to be doing a lot less business.
Okay. The most important expenses of a restaurant or a bar, you have two of them. You have paying your employees. So we have a program coming from the federal government to help paying the employees. And the second expense is the rent. So that's why we put in place a reimbursement of, I think it's 80% of the rent. So we think that this must help to be ready for the reopening. And I hope that the reopening be as soon as possible. But right now, we cannot afford to see this increase in the number of cases. And we're not the only ones closing restaurants. You can see what's happening in New York, in Boston, in Paris. Look at what's happening in Europe. And we're lucky in a way because we didn't see in the last few days an increase in the number of cases. But you've seen in France yesterday 52,000 new cases. It's like if we had 6,700 new cases in Quebec instead of 800. So I think we were successful having a plateau, but now we have to decrease, and unfortunately we have to keep bars and restaurants closed for another month.
And just before I get to the second question, the second part of that was, are there other measures for aid that can be thought of at this time to try to help them even more through another 28 days?
We don't think about other measures for now. We think that these measures must be enough.
And my second question for Mr. Arruda and Mr. Dubé, talking about treatment of COVID-19, what can you tell us about how things have improved? We've seen reporting out of the United States of a serious decrease in the number of deaths related to COVID-19. What's the portrait right now in Quebec? Are hospital stays going down? Is the mortality rate going down? What are we seeing?
In fact, yes, I think there is better therapy and knowledge about how to treat severe cases, and then the mortality is going down. But it's not perfect. I think that there is a tendency to a better mortality, but it depends which groups are also attacked. If you're talking about elderly people over 70 years old, they often will decease from the disease. But I think that in some young adults, better young adults with some treatments with steroids especially and others protocols, the survival rate seems to be better. But I think it's still a disease that if you have any health conditions can be very difficult for you, and stay with some, I would say, even if you survive, you can stay with pulmonary problems, agnosia and everything, even in young persons. So I think it's still a serious disease, and I think preventing it is better than getting it.
So we'll go with Gabrielle Famy from CTV.
A lot of people have been telling us they've been having a hard time getting an appointment for a flu shot. Either it's all booked, or there's a lot of seniors who don't necessarily know how to go online and book an appointment. So what are you going to do to make sure that it's accessible to all Quebecers?
Yeah, I think the best way for us will be in the coming days. I think that's probably in the coming days, so Wednesday or Thursday, that we'll have a briefing point to explain what is the plan as of November 1st. I think there is a big change that people need to understand is before, when we had the flu session, we could go into a large arena and bring a lot of people, and you didn't need an appointment. But as you can imagine, we cannot do that anymore. So the first good news is that we have made an arrangement with pharmacists, and they will be part of that program. But I think we need to explain people to the population as to how they can make appointment either with the pharmacist or with the CLSC, and I think to make sure that we explain those rules very well. We'll have a briefing point as we do today, but will be only dedicated to the vaccination period. I think we're planning it for Wednesday or Thursday of this week.
Okay.
Right.
And my second question is about mental health. Obviously, like it's a big concern as you know, these measures are extended and everything. There's currently maybe a 6-month waiting list to see a psychologist, for example, and you have people like the Association of Psychotherapists in Quebec who have said they're available and ready to help, but it's not covered by a lot of insurance plans. So are you, you know, considering changing things there, or?
Okay, just to give you a few figures, the waiting list today is shorter than the waiting list last March. So, of course, maybe it's still too long, but it's getting better. Lionel Carman already hired 300 additional professionals, and he's looking to add another 300, so which will be 600 more people for giving services to people having mental health problems. Want to add something?
And I think we have in our plan to, as the Prime Minister, as the Premier has asked, to make sure that if we can add also different services, we'll do that. So I think also in the coming days, you'll see things coming.
Okay,
because we know mental health is a big issue, and especially when we come in November, it's getting darker, and we know we're asking sacrifice, so there will be additional thing coming our way.
Thank you.
Merci tout le monde. Bonne soirée.
Merci beaucoup.
Bonne soirée tout le monde.
So good evening, everyone. Thank you.